Part 2 of Chapter 6, you will learn how tumors are named, features of invasion and metastasis, and how tumors are diagnosed, graded, and treated. There are some general rules that are followed when it comes to naming tumors. First of all, tumors are commonly named from the parenchyma, or the functional tissue that they come from. Benign tumors end in oma. Some examples here are fibroma, which is a benign tumor of the fibrous tissue, chondroma, which is a benign tumor of cartilage tissue. For malignant tumors, if it's in the epithelial tissue, then we will call it a carcinoma. So an example would be squamous cell carcinoma. If it's from a glandular tissue, we would call it adenocarcinoma. Or from melanocytes, it's called melanoma. Mesenchymal tissue, or connective or soft tissue, would be a sarcoma. This can be a little confusing because this melanoma ends in actually noma, N-O-M-A, not just oma. So again, it's not foolproof, but you can generally tell if a tumor is benign or malignant by its name. And you should look at Table 6.1 in the text to see more examples for the nomenclature of naming tumors. You can expect at least one question on the exam about naming a tumor. Some characteristics of benign tumors include the cells tend to resemble normal tissue in that they're well differentiated, and they can perform the function of the normal tissue. For example, if the tissue, like a thyroid tissue, is supposed to secrete hormones, then you could have an oversecretion of thyroid hormones if you have a thyroid tumor. Benign tumors tend to grow slowly. They're also surrounded by a fibrous capsule, and that capsule keeps them from infiltrating or invading or metastasizing. They can damage nearby organs, however, by compressing them. A benign brain tumor can still be devastating because the tumor can compress normal brain tissue and cause lots of serious symptoms like seizures and even death. Malignant tumors contain cells that do not look like the tissue of origin, and they're unable to perform the normal functions of the tissue. The tumor may secrete signals, enzymes, toxins, etc. Remember that malignant cells, and thus malignant tumors, tend to proliferate rapidly, and they can continue to mutate. They don't have capsules like benign tumors do, and they tend to send legs into the surrounding tissue. The actual word cancer means crab or legs, crab based on these legs, because people thought the cancers looked like crabs. Also, malignant cells can enter and leave blood vessels, and through the blood vessel in the bloodstream be carried to other parts of the body. This is called metastasis. There are two categories of malignant neoplasms: solid tumors and hematologic cancers. Solid tumors are initially confined to a specific organ or tissue, but they will eventually invade and break through the original tissue, ultimately entering the bloodstream and the lymphatic channels. From there, they are carried to other parts of the body. Hematologic cancers are already spread throughout the body because they're in the bloodstream. An example of a hematologic cancer would be leukemias or lymphomas, and we'll talk more about leukemias and lymphomas in a later chapter. Cells that remain localized and have not yet crossed the basement membrane are referred to as cancer in situ. This is a really early stage of cancer and is generally considered 100% curable. Let's talk a bit more about metastasis. When cells in a primary tumor lose adhesion, escape, and travel to another point in the body, that would result in a secondary tumor. There may be some mutation, but generally we would expect the primary and the secondary tumor to look a lot alike. As mentioned, the metastasis would happen via blood or lymphatics. Sarcomas tend to metastasize more frequently via blood, while carcinomas tend to metastasize more frequently via the lymph channels. For cancer to develop, which is carcinogenesis, there needs to be initiation, or in other words, there has to be a mutated cell. And that mutated cell will go through mitosis and division and multiply fairly rapidly. That's called the promotion phase of cancer. And finally, tumor cells will begin developing more mutations and competing with one another for resources, which makes them more aggressive. And this is the progression stage of the disease. For a cancer to survive, angiogenesis must take place. So the cancer cells have the ability to grow their own new blood vessels. How they do it, we don't fully know, but there's a lot of research going on to understand the angiogenesis capability of cancer cells. There's a long list of factors that cause cancer. First of all, there are genetic links for certain types of cancers. You've probably heard of the BRCA1, BRCA2 gene, or there's also problems with the retinoblastoma gene, the RB. So women who carry the BRCA gene are at increased risk for breast cancer and ovarian cancers. Men who carry the gene would also be at higher risk for male breast cancer, as well as other cancers like melanoma and pancreatic cancer. Reproductive hormones can also be associated with cancer development. For example, breast cancers are tested in terms of how they behave around estrogen or progesterone. Estrogen-positive breast cancers are treated with estrogen-blocking drugs, and that keeps the estrogen from feeding the tumor cells. Persons who are obese have higher risks of cancer. This is thought to be due to an overproduction of insulin and insulin-like growth factors. Overproduction tends to stimulate cell division and inhibit apoptosis. And finally, we develop these would-be tumors all the time, but luckily our immune system is able to recognize and kill them. This process might be inhibited if people have immunodeficiencies, so the immune system's just not working correctly. Also, cells can change the expression of the proteins on the surface, and that change in the genetic expression hides them from our immune system. Cigarettes, alcohol, diet, all have been known to damage DNA, RNA, or to hurt the proteins that are involved in cell proliferation. Radiation directly damages DNA or resulting in gene or chromosome changes. Viruses and bacteria may stimulate changes in normal cells that would result in a tumor. For example, the HPV virus can cause a stressful environment, I guess I should say, in the cervix or in the esophagopharyngeal area, and these can cause tumors. In fact, HPV is found to be the most common reason for women to develop cervical cancer. The Epstein-Barr virus, which is the virus that causes mononucleosis, has been associated with B-cell cancers and Burkitt lymphomas. Patients with hepatitis B and C show an increase in their rates of liver cancer. And human T-cell leukemia virus is a retrovirus that affects T cells and can lead to a proliferation of T cells. I suspect many of you have known people with cancer, and some of these systemic symptoms will be pretty familiar. For example, many cancers are associated with weight loss and muscle wasting. The term for this is anorexia cachexia, and that refers to weakness and body wasting that is due to a chronic disease. Although cancer treatments can make people nauseous and diminish their appetite, the cachexia is way more pronounced than could be accounted for by diminished calorie intake. It's believed to be predominantly related to the hypermetabolic state. It takes a lot of energy for the rapid cellular division of tumor cells. Circulating cytokines are also thought to play a role. Cancer disrupts tissue integrity. Tumors cause local tissue compression and erosion of blood vessels. One of the first symptoms of colorectal cancer is blood in the stools. Anemia is also common and might be related to blood loss. It also is likely related to impaired red blood cell production, or could even be an effect of the cancer treatment. People with cancer also experience fatigue and sleep disturbances. Sometimes cancer cells actually produce extra hormones, or they cause endocrine glands to oversecrete hormones. For example, in some types of lung cancers, there is an overexcretion of adrenocorticotropic hormone, ACTH. In this paraneoplastic syndrome, patients develop Cushing's syndrome. We'll talk more about Cushing's in a later chapter, but generally people with Cushing's have abdominal obesity and thin arms and legs. Cancer is diagnosed by cytologic studies, tissue biopsies, or tumor markers. An example of a cytologic study is a pap smear. Cells are scraped from the cervix, they're plated on a slide, and a pathologist views the slide to see if they can find any abnormal cells. There are many examples of tissue biopsies. For example, if a mass shows up on a chest x-ray, the patient may go have a needle inserted into the mass to aspirate cells, and then again, the pathologist would view those cells to provide a diagnosis. There are several tumor markers that are used to diagnose cancer, but these tumor markers can also be used to follow cancer progression or response to treatment. Patients with prostate cancer will have blood tests to determine the level of their prostate-specific antigen, or PSA. Men ages 40 to 49 should get a PSA at a baseline, and if the levels are elevated subsequently, then a biopsy would be performed. And lastly, we're going to talk briefly about this microarray technology, or using gene chips to diagnose cancers and to guide therapies. In microarray technology, cells from the tumor cells are used. Breast cancer was the first type of cancer to be extensively studied using this technology. Not only has it helped us better understand the many different differences in breast cancer between one person and another. It also provides a lot of prognostic and predictive information, such as who would benefit from chemotherapy after surgery. This slide lists several tumor markers. Usually tumor markers are found in the blood, but they also may be in urine or body tissues. If people are being treated for cancer, again, decreases in their tumor markers tell us that the treatments are likely working. Tumor grading. Tumors are graded on a scale of 1 to 4, and this is based on their differentiation and the number of mitoses. Grade 1 tumor is well differentiated, where a grade 4 tumor is poorly differentiated. Tumors are staged with regard to the tumor itself, the lymph node involvement, and metastasis. So that's the TNM staging. You do need to know the TNM staging classification system for the exam. There are 3 major modalities used to treat cancer: surgery, radiation, and chemo. In surgery, the tumor and the surrounding area tissue is removed. Radiation therapy involves using ionizing radiation to kill tumor cells and shrink or eradicate them. And often surgery and radiation can be used together. Maybe the patient will have radiation therapy first and then have surgery to resect any remaining tumor. The radiation therapy would be given to shrink the tumor. Chemotherapy provides a systemic approach. So you can kind of see that direct surgery and radiation would be working more locally. Chemotherapy targets any rapidly growing cell in the body. The drugs that are used usually target a specific stage of the cell cycle, and multiple drugs are commonly used. Since both radiation and chemotherapy kill rapidly dividing cells, this explains why people lose their hair with these cancer treatments. Hormone and anti-hormone therapy are specific types of pharmacotherapy used to treat cancers. For example, in estrogen-positive breast cancer, women take the estrogen-blocking drugs to prevent tumor growth. There are also new biotherapies and targeted therapies that use monoclonal antibodies to tag cancer cells and label them for destruction. So the antibody actually draws our natural killer cells from our own immune system to kill the cancer cell. Childhood cancers, luckily, are relatively rare. They account for about 1% of the cancers in our country, and the survival rate for childhood cancer is about 85%. If kids get cancer, it's generally within the first few years of their life, and childhood cancers are typically blood and bone marrow cancers like leukemia. Some warning signs of possible childhood cancers include a prolonged fever, fatigue, and bone pain, persistent enlarged lymph nodes, unexplained weight loss, and a growing mass. That concludes this discussion of Part 2, Chapter 6. So please let me know if you have questions.